Hi, I'm Becca Gregory, and I've got a presentation on the Wilms tumor in preschool-age children. The Wilms tumor is a nickname for nephroblastoma. This is a rare form of kidney cancer that is most prevalent among preschool-age children. Children in the 3 to 4-year-old age group, to be exact. Chances significantly drop of getting nephroblastoma once the child turns age 5. This type of cancer, if caught early enough, typically is contained only in one kidney, and modern medicine provides a good outlook for the child. Upon diagnosis, a patient is going to undergo a series of tests, imaging, and/or a procedure to be staged. Staging is doctors' way of diagnosing the prognosis of the cancer. This is also a tool that parents can use to determine what exactly is going on with a child's cancer. It is also a tool that doctors and surgeons alike can use to work as a team and figure out a course of action for treatment. So a child, if it's diagnosed as stage 1, this means the cancer is contained in one kidney and has not spread to the tumor, or the cancer cells have not spread to the tissue surrounding the kidney. The cancer can be fully removed with the surgery, and likely no biopsy has been done yet. Stage 2 means the cancer can still be fully removed, but has likely spread to the tissues surrounding the kidney. This also means that the renal sinus may have been affected. The renal sinus is the area where the kidney connects the ureter to help the child urinate, as well as this contains the blood vessels where the child's urine is made. Stage 3, this means the cancer has spread to the lymph nodes. The cancer may not be fully removed, and likely part of the tumor will stay in the kidney after surgery. If removed, the tumor will be removed in parts. Cancer has begun to spread into the abdominal structures and may have hit the pelvis, but has not spread outside of the abdomen yet. The tumor may have also broken open before or during surgery, spilling out cancer cells. Stage 4 means the cancer has spread to outside structures. This means the cancerous cells have used the bloodstream to transfer to places such as the liver, the bones, and/or the brain. Stage 5 is what the doctors call a bilateral tumor. This means upon diagnosis, tumor is found in both of the children's kidneys. This means that they will likely perform a radical nephrectomy. This is when doctors take out all or part of both kidneys. When this occurs, a child will be placed on renal dialysis until a transplant can occur, and likely will be on chemotherapy and radiation therapy in between those two. So not all children show obvious symptoms, but symptoms that may be present are an abdominal mass that you can feel through the skin, abdominal swelling, abdominal pain, fever, blood and urine, nausea and/or vomiting, constipation. The child may experience a loss of appetite, shortness of breath, and/or high blood pressure. So currently there are no exact known causes for the Wilms tumor. However, research does indicate that it may be hereditary. Some risk factors that are known include children being ages 3 to 4, as I said earlier, and like I said, the chances do drop significantly as the child gets older. Children of African American descent are also more likely to develop a Wilms tumor. Children diagnosed with some diseases at birth, such as hemohypertrophy, may be more at risk as well. Another disease is adrena, where the iris of the eye is not fully developed at birth. The Wilms tumor may also develop as a side effect of some diseases. These include Denny's rash, Wagner syndrome, and Beckwith-Wiedemann syndrome. So preschool-age children and their development. Preschool-age children are in Erikson's initiative versus guilt stage, and in between Piaget's concrete operational and formal operational stages. This just depends on exactly how old the child is. This is an age range. These kids likely use symbolic play and associative play. These children also really start to like make-believe play, and child life specialists should be able to use that to their advantage. Children at these stages also are trying to find their ambition and drive for life and things and hobbies they may like later in the future. A child life specialist should be able to have a variety of situations that they can use, especially when they're pent up in a hospital room. This could be through books, movies, even coloring pages or dolls, and exposing them to a lot of different things the child may like. and a lot of different make-believe scenarios that they can come up with. So some good resources I like are the Children's Hospital of Philadelphia website, and I'll actually take you to that. Come on. Oh, there we go. It's loading. Basically, this website, it's CHOP's website. This is a great resource. This is a Wilms Tumor page specifically. It's for parents, and it has all different types of links for support groups, books, videos, FAQ pages, and a lot of different resources for the parents to understand themselves and their child and how to support everyone during their sickness. This also has links to explain what exactly is happening with the cancer. Additionally, as you can see here, if I can get it better, this is the Wilms tumor. So this yellow thing right here is the tumor in the kidney, and this is how it affects everything. So right here, this is the ureter and the renal sinus. So if the tumor is blocking this part, this is where the cancer cells can spread. Also, here's a picture right here of the Wilms tumor in a real kidney. These may be helpful to use to show the parents or children. I find diagrams really helpful because I am a very visual learner myself, and it's easier for me to explain things when I understand them. I also find it's very helpful for parents because I've talked a lot about the children, but the parents are important too. The parents, I like to give them breaks as often as possible, and also be there emotionally for them. That's important to understand because with this age group where it is most prevalent, I mean, they're still their babies, and it's hard with any age, but it's really hard when you have a child with cancer, and they're not going to leave, and they're gonna, be tired and stressed out, and it's really important for you to be there for them as a friend and as a child life specialist so they can understand a little bit more. You need to be knowledgeable as possible, and doing some research when you have a patient that gets diagnosed with this is very helpful. Some other good resources are the book I'm a Superhero by Daxton Wild. This book was written by Daxton Wild and his mom after he survived childhood cancer. This explains the whole cancer process and chemotherapy in children's terms with cool illustrations done by a child. Another great video I like is Paul the Dragon video. This video is a 20-minute long cartoon, and it explains this guy Paul, and he has cancer, and it shows him through diagnosis, shows him going to an MRI and surgery, and it goes inside the body and shows little characters of the cells and the cancer cells, and shows the chemo cells being the good guy. The only thing about this video is the first 4 minutes of this video may be a little scary for some children, but they can still get the full benefits afterwards. Ooh. Oh no. Okay, so the effects on the child's development. So if the tumor is stage 3 or higher, they will likely be hospitalized for a while, or they will be hospitalized frequently. Even if the child is stage 1 or 2, the child will be hospitalized frequently, but they will likely not undergo chemotherapy or radiation therapy, which is what really keeps the child in. So when this child is trying to find their ambition and drive for life and their independence, they're going to want to be up and walking around. They have all this energy, and a child life specialist should be good at really coming up with make-believe scenarios. I think is key. Whether that means bringing in like a toy stethoscope and they can pretend they're the doctor, or just like activities they can do in bed. Like I said before, I like coloring pages because they have a lot of different jobs and hobbies and things that the children can kind of see doing and dream about. So MRI scans, CT scans, and PET scans are all really common for children with nephroblastoma. This is because the doctors want to ensure that recovery and also keep track of the tumor's prognosis and make sure that treatment is working effectively. So preparing the child is essential to keeping them calm and getting the clearest scans possible for the doctor. So ways that child life specialists can do so is either, if the hospital allows, taking them into the rooms where they're going to get scanned and seeing exactly what the machines are going to do and the noises they make. Another great tip is to use videos online. There are a lot of videos online from child life specialists who explain what an MRI and a CT are. I also like to use a surgical doll or the child's favorite stuffed animal to show them what exactly is going to happen. And additionally, if the hospital allows, headphones are a great resource for children in MRIs or scans. Because these scans are so long sometimes, children can use headphones to listen to audiobooks, their favorite movie, TV show, or even music. This really helps them pass the time and keep calm and still. Also, if the hospital allows child life specialists in the scan room, that is a great resource to keep them calm and talking to them as well. A common course of action for this diagnosis is a nephrectomy. A partial nephrectomy means the doctors will go in and take out part of the kidney and some of the surrounding tissue. A radical nephrectomy is when they will take out all of the kidney, the surrounding tissue, some nearby lymph nodes, the adrenal gland, and or some part of the ureter. Understanding what this happens or what this is and explaining it to a child is essential. A child life specialist needs to be able to explain to a child that they're going to get a pokey, they're going to have the bunny mask, and they're going to breathe in for a minute, and they're going to take a really long nap, and then they're going to wake up. Using a surgical doll is really helpful for this, and you can let the child do their own pokes and have fun with it while they're learning. Another key for a child life specialist is to be repetitive and patient. As long as the children are asking questions, you need to be there, present, and have an upbeat spin. Also, repetition is really helpful because I find that it really helps the children learn exactly what's going to go on, and repetition helps it stay in their mind, so they can have less room to create all these crazy scenarios in their head. Another tip is to build a really good relationship with the patient if possible. Sometimes child life specialists are allowed in places of the hospital where parents are not, and if they can walk to surgery with them before they sleep, that would be really helpful to have the children calm and feel better about everything. So chemotherapy and radiation. This is a big deal because if only part of the cancer can be removed or if the tumor needs to be shrunk before surgery, chemotherapy or radiation therapy is a very likely course of action. You need to explain to the children what's going to happen because likely they're going to have to undergo another procedure. This procedure is going to contain where they put the port in their chest, but you could talk to the children about how they're going to have another pokey, they're going to have the bunny mask again, and then they're going to go to have a nap, and then they're going to have this cool wall in their chest where the medicine can go in and out, kind of like a magic portal almost, and then they don't have to get as many pokies from the medicine. So you just need to explain what's going to happen, and every case is different, so they might not be getting a port, but they may. You also need to understand the side effects of this and make the parents aware and the kid aware as much as possible. So side effects of chemotherapy are nausea, vomiting, loss of appetite, loss of hair, and places the child at higher risk of infection. This is really important because when the child is at higher risk for infection, they may be placed in isolation and not allowed to leave the room. So this goes back to their development because, like I said, they are going to want to be more independent in finding themselves. But isolation procedures mean that likely anyone that enters or exits the child room who's not the parent will have to wear a mask, gloves, and a yellow gown. This can be really scary for a child, and it also reduces normativity in their lives when everyone they see is in all these gowns all the time. So a child life specialist should be able to do a good job at, copying books or coloring pages for that child specifically, or giving them little things such as the hospital should have a supply of Play-Doh or crowns, things that you can keep that also stimulates their development. If they're up to it, there's little things you could use such as Dance Dance Revolution, which is a game for PlayStation or TV somehow, and they get up and they dance a little bit, but they're not moving too much, and it's just quiet and contained in their room. This is where movies kind of come into play, and as much as you don't want a child to be on the laptop or iPad all the time, it is helpful when the child can't do much. So there are a lot of games that help them learn, they're kind of like a modern day leapfrog situation. Another thing is if they are in chemotherapy or radiation therapy, they're likely going to be sitting for a while. And so this is where iPads are really essential, and you can help them watch TV or keep calm during those chemotherapy sessions. It's also helpful to have the child life specialist there in addition to keep them calm or play with them and do whatever needs to make them happy. and comfortable, most importantly, comfortable. So that is the Wilms tumor. Thank you very much.